Would you like a second opinion on your diagnosis? Please send your analysis and medical history to visite@qs24.tv, and our Chief of Medicine, Dr. Wiechel, will analyse them for free and anonymous in our new series, Wardround. For more information, visit www.qs24.tv. Welcome to our next episode of Wardround, where I will answer your questions. And I am really happy to do that, so I will get started right away. A reader from Switzerland wrote, "What about Hashimoto and iodine? A topic that burdens a lot of people. And Hashimoto is an autoimmune disease. Hashimoto is a disease that we have hardly known about 25 years ago. I was a student in Berlin at the time, and it was not possible to show us a Hashimoto patient in the large Charité clinic. Today we have an upward trend that is incredible. But it is an autoimmune disease that results in, due to the antibody inflammability against the thyroid that we will get, a thyroid hyperfunction in the long run. Today, a thyroid hyperfunction, whether due to an autoimmune disease or due to unknown causes, is treated entirely through thyroid hormones. But our thyroid is an organ that has a production facility, and that is the thyroid gland here. But it is not the place of function, but the thyroid gland alone is in direct cooperation with our pituitary gland, with our brain, and with our adrenal glands, an important regulator for our body, but also sometimes an important compensator for a weakness that takes place on another level, for example in the area of the adrenal glands. Hashimoto arises when three important conditions are met. That means I always have to look at Hashimoto patients. How about their digestion? How about their detoxification? And what is the genetic disposition? So, do they have a good, a fast, a slow, or a delayed detoxification? Or are they maybe zero detoxifiers, because the thyroid as an organ is also ready to absorb toxic loads? Quite this reactivates Epstein-Barr strains because viruses live intracellularly, and viruses have a high tendency to reactivity. And that's the case especially with Epstein-Barr. This is the disease that we might experience as a child as glandular fever, the so-called infectious mononucleosis. However, by this inflammation of the antibodies, which is triggered against the body's own cells, a destruction of the thyroid hormones occurs. And that is why it is very important that we look at these things in advance, recognise them in advance, and get it under control long before a slow destruction occurs, which we do not even notice for a long time. Hashimoto is the result. It is the name for an autoimmune event. And now, of course, you have to watch where we pick up this patient. If, due to this long-term inflammation, the thyroid ultimately has to accept a situation that it only works with 30% or only with 40% or only with 50%, then it is a very good idea to balance it with thyroid hormones. And now we come to the iodine. The thyroid hormone production that takes place in the thyroid gland is that we need tyrosine as an amino acid and iodine. And iodine is made up of iodine and iodide. This combination, which you actually only find in brown algae, in red algae, and also in Lugol's iodine, and that together with cofactors of the metabolism, vitamin B6, magnesium and so on, let T4 arise in the thyroid gland. But then outside the thyroid, with the help of the kidneys, the liver, T3, is developed, and the T3 is now the active thyroid hormone which acts intracellularly. This means that no cell can perform at full capacity every day without this hormone requirement. And if I have a thyroid hyperfunction, if there is a hot lump, and thyroid hormones are powered and formed non-stop, then of course I am not allowed to fuel them up with additional hormones, let alone iodine. But I don't share the point of view that iodine would be a contraindication when a Hashimoto is present. I have to decide exactly where do I pick up the patient. If it is still thyroiditis at the moment of this inflammatory event, or was it a long time ago? And I accept a thyroid hypofunction due to an autoimmune development and want to bring the thyroid to provide more thyroid hormones tomorrow through an active thyroid function. Hashimoto's disease itself also has causes, of which I spoke, and a thyroid therapy must always be accompanied by the monitoring of the autoimmune disease. What we observed when we do that, the thyroid antibodies decrease again. This calms the process down. We need to recognise if the Epstein-Barr reactivation is active, and if it is active, then we have to take care that immune performance reactivates these active Epstein-Barr viruses again tomorrow. All of this is quite possible. Of course, you also have to recognise how the immune performance is. So you can do a lymphocyte typing test. This lymphocyte typing test has the task of recognising which immune fractions are sufficient and which are insufficient in the defence against viruses, in the defence against parasites. And that is a very valuable test. And of course, you can also rule out whether there is an Epstein-Barr exposure. The Epstein-Barr it lives with us. We already get it with pregnancy, but it is inactive in the cell. A virus is an intracellular building block. It's just a tiny strand of RNA, a strand of DNA without protein shell. But what makes it reactive? What makes it so active that it also exerts a destructive process on the cell? You have to know all this. And therefore, I should not be understood. Hashimoto needs iodine. You have to look very carefully. On the one hand, what triggered this autoimmune disease? Is it still being triggered? Are the antibodies increasing? Or is this a process only a consequence of a process in the past? And the other thing is that when you work with iodine, and we see 80% of people have an iodine deficiency, in the past it was perhaps still possible, visible through these large strumi. But today it is visible through the weaker immune performance, because iodine has a very disinfecting effect, and when it comes to parasites, bacteria and fungi, iodine makes you very warm, iodine regulates relaxation, iodine creates such a deep warmth, iodine discharges, especially bromine, heavy metals, mercury, lead is bound by iodine, and iodine must be available for tyrosine, actually to build more thyroid hormones for the body. and that is actually a very valuable therapy that you should then use. Maybe also with an experienced colleague in the field. Lugol's iodine is available in pharmacies with a prescription. We can, or I can recommend, a so-called skin test with Lugol's iodine 2%, that the skin is not that damaged, and then you paint a 6 by 6 centimetres iodine stain or a tattoo on the forearm. Best to do this in the morning, and then see how long it takes for the iodine to disappear. And if it vanishes quickly, I sometimes experience 3 or 4 hours, then you know how much your body needs iodine. If, of course, you can still see it the next morning when waking up again, still visible after 24 hours, then you have to approach it very cautiously. But if it's gone quickly within 12 hours, for example, then there is a need for iodine. And iodine is consumed in the form of Lugol's iodine. Iodine is a substance that you then take in as drops, or you can apply it to the skin. Then stick to the 5%, but drop by drop, and not as much as in the test. But the iodine cure is always prepared with a 27% Himalayan brine in advance. This is actually a chunk of Himalayan salt which you put in a large glass of water, and then it's a 27% brine when the chunk is dissolved. If that's such a chunk, it can be half a litre. Drink a teaspoon of it every morning with a glass of water. This is a very good base mineralisation because all the elements of the periodic table are in this iodine or in this brine, and thus, of course, prepare the entire process well. Trigger it, and then influence the effect of the iodine. And then you start with Lugol's iodine, and you can proceed there with a drop per day and slowly increase this dose. Always be aware that there are 75 milligrams in one drop of Lugol's iodine. And please adjust this dose yourself. I can't give a recommendation here, you need 20, 30 milligrams. I only know that if we have a reactor accident here in Switzerland or Germany, then I have to prescribe you 130 milligrams of iodine per day, so that you have sufficient protection for your thyroid, for your organism. And there you see the relation. 7.5, 130 is a must. And in this way, the body is, of course, incredibly grateful to slowly receive more iodine, so that it can then take on these tasks again. Of course, if the thyroid turns into too much, then you will notice it, then you sweat, then you are nervous, then you are restless, and then you have to talk to a medical colleague accordingly and accompany that slowly with great care. Give the whole body just a little bit of information, but I have an incredibly wonderful feedback in the context of iodine substitution, and then, of course, of what the body then is able to do again alone. That was the question now about Hashimoto and iodine. And the other question was, what is leaky gut syndrome? Leaky gut syndrome is a disease of the bowel. And a leaky gut syndrome is called permeability disorder. Leaky, it's dripping, gut, the bowel is dripping. So the temporary barrier between the inside and outside is the bowel, the intestinal mucosa. And this intestinal mucosa is naturally secured 3 times. It's like a wall. And nobody who is not able to identify themselves is allowed to pass it. That means that every protein that is split and is present as amino acid building block in the intestine needs an entry paper. Every vitamin, every mineral, all need a reference paper. Bacteria, fungi, parasites are absolutely rejected and must be discharged through the bowel. Mercury, all these things are rejected, have to be discharged through the bowel. But now there is a very big concern at this time, and that are so-called silent inflammation reactions. So silent inflammation that occurs in the intestines, I don't mean the permanent ulcerative colitis or Crohn's disease, but what 99% of people have to tolerate. And that is inflammation that creates instability in our bowel, unnoticed for weeks or months. My guess was years ago that it's no longer the milk, but it's the gluten, it's the grain. It is the gluten-containing grain that uses gluten as a sticky protein. That is why you have such great baking properties with wheat. You can do anything, but it has the highest proportion of gluten, and this gluten is something in our food that we are not really prepared for, and this gluten does something to us. The grain has only been existing for 10,000 years. That means we can't speak of an adaptation here. Just as, for example, the cow is adapted to grass and water. If you put a piece of cake in front of it for its birthday, or maybe a little cappuccino, then the cow will get sick within a short time. We humans have to maintain a certain order in our lives. And this massive amount of gluten in our grain and the high consumption of grain causes these irritations on our intestinal mucosa, and if it gets more and more, then we destroy these immune checkpoints. This is a bacterial level. This is the secretory IgA, and it is the Peyer's plaques. That's what these barriers are called. And if then, through a chronic, quiet, latent inflammation, real holes arise, which you don't even notice, it's all somewhere here, unnoticed to us, then you push, but with huge kindness, you now push bacteria, fungi, parasites, scatole, hydrogen sulfide, ammonia and whatnot. Everything gets into the blood first. And do you know what is happening? A dramatic immune response is now required. The problem is, if that is not recognised, it is one of the bases for the development of diseases that you will have tomorrow, and a very, very, very important one, amongst others, autoimmune diseases. Amongst others, fibromyalgia. It's a disease that doesn't exist, but it is just a chronic inflammatory pain problem that becomes visible on a physical level. But for a long, long time before that, something preceded it that you did not even notice, because life celebrates us. How high, how valuable, and above all, how much enjoyment and how delicious all these things are. You can look where you want. Everywhere there is a smell of croissants and all these things. But the bowel is not asked if it loves it and if it likes it at all. Therefore, a suspected diagnosis of leaky gut, or at all, we have to run the clinic to be absolutely 100% gluten-free, so that I can at least get people for a short time to experience how it all feels today. If I only take away this toxin for flammability. And of course, there are wonderful ways to bake gluten-free today. I wouldn't want to eat that either, these packaged gluten breads that you can buy. But it's so easy and it's so wonderful. Made from rice, corn and potato flour, and from lots of chestnuts, wonderfully delicious things to be worth to yourself. To make these things for yourself. Leaky gut must be excluded. and living gluten-free affects 85% of the population. That means I don't mean to say it concerns, but I want to say that gluten is responsible for 85% of sicknesses, because we as a human population, with contamination on the most diverse levels, but also have become highly vulnerable here. And the bowel, I repeat myself, is the root of the plant, so to speak, is to be taken very seriously for you to create the conditions so that you can take the load that the body is creating every day and reduce inflammability on a physical level. And I always say it like with a tree, you don't see this huge root in the ground, maybe another 30 or 40 metres, in the case of a large oak, down there that has the task to strengthen this powerful tree. And whenever it is not possible in a disease to bring this strength back that a German oak has, but I was born near the Baltic Sea at the Greifswalder Boden, and there were mugo pines. You know mugo pines? They look anything but beautiful. They grew completely crooked, but they are strong. They are very strong. And they withstand every storm. And I wish you the same from my heart, but create the conditions. And I ask everyone to take these things first as a first step. Also in the treatment of individual problems. With this in mind, thank you very much for your attention, and I am already looking forward to next Sunday. All the best. Dear viewers, the preceding episode is an indicator for a holistic medical approach and does not replace visiting your family doctor. Thank you.